Hey, now we're gonna do the lower limb. So here we go. And so we have pelvis, pelvic bones, also called the os coxa. And so this bone actually is composed of three bones. There's the ilium, there's the ischium, and the pubis. Here. There's a hole in the middle called the obturator foramen. The ilium has the iliac crest, which is you can palpate on yourself. We have the anterior superior iliac spine and the anterior inferior iliac spine with the surface for articulation with the sacrum, and we have the ischial spine here, and we also have the, sorry, I keep moving through here, we have the sciatic notch, or the sciatic nerve. So sciatic nerve fibers come out and they go down and then descend down the posterior part of the thigh. Then these three bones, the ilium, the ischium, and the pubis all come together to create the ilium and the ischium and the pubis all come together to create the acetabulum here. The acetabulum is where the head of the femur fits into. So there's the head of, here's the head of the femur, and it fits into a ball and socket joint for the acetabulum there. Then we have the head of the femur. This is the femur here. So this is a right femur. This is the head of the femur. The neck of the femur is here. This here. Here's the greater trochanter. Here's the lesser trochanter. The lesser trochanter is on the medial side. The greater trochanter is on the lateral side, as you can see there. Then we have so this is the medial side here. This is lateral over here. So this is the medial condyle of the femur, and that's the lateral condyle of the femur here. If I flip it over, you can see there's a notch between these two condyles. This is the intercondylar notch, and this is where you'll find the ACL and the anterior cruciate ligament and the posterior cruciate ligament passing through. Then the femur articulates with the tibia, and this is the tibia here. The tibia, we have the tibial plateau, the condyles of the tibia here and here. And then we have the tibial tuberosity where the patellar tendon attaches. You can palpate that on the front of your tibia. You have the anterior crest, and down at the base, or down at the posterior, or the distal end, not posterior, but distal end, sorry, we have the medial malleolus. And then we have the surface for articulation with the talus, one of the ankle bones. Then we have the fibula is here. We have the head of the fibula, and then we have the distal end is called the lateral malleolus. So since we have a medial malleolus, we have a lateral malleolus. And the head of the fibula fits underneath here and gives you and that one's a little bit bent, so anyway, we have the fibula. Then this is less bent. So with the less bent, we'll use this one to show a lateral malleolus and medial malleolus. Then that fits into and makes a notch down here for the talus, which is one of the ankle bones, or the tarsals. That's the talus right here. That's the calcaneus. So the talus fits into this notch created by the medial and lateral malleolus, and that creates the talar, T-A-L-A-R joint. So we have the tarsals, and we have tiger cub needs milk, so talus, calcaneus, navicular, medial, intermediate, lateral cuneiform, and cuboid. And there's your tarsals. Then we have the metatarsals here, and they're numbered 1, 2, 3, 4, and 5. This is metatarsal 1, 2, 3, 4, and 5. Then we have the phalanges. Here's the big toe called the hallux, and we have 2 phalanges for the big toe And we have 3 phalanges for all the other toes. So we have a proximal distal phalange for digit 1, and then we have proximal middle distal for digit 2, proximal middle distal for digit 3, proximal middle distal for digit 4, and proximal middle distal for digit 5. And there you have the lower limb. And to tell these bones apart, always the acetabulum is always lateral on the pelvic bone. Okay? Iliac crest is always up, and the pubis bone is always forward. So that makes this one a right, and that would make this one a left. The acetabulum is lateral, pubis is forward, and the iliac crest is up. Then this is a left, so that's a left pelvic bone. This is a left femur, because the head of the femur has got to fit into the acetabulum there, and the greater trochanter is going to be lateral. The condyles are going to be distal, and so this is going to be a left femur. Here's a right femur. It fits into the acetabulum, and the greater trochanter is always lateral. This is a left tibia. The condyles of the tibia, the tibial plateau here, and then the medial malleolus, and that's always medial on the tibia, and the tibial tuberosity is always forward. Anterior crest, tibial tuberosity on the right one, tibial plateau, tibial tuberosity, anterior crest, and then the medial malleolus is medial. And then the feet are easy because the big toe is always medial on the feet, as you can look at your own feet and see that. And then we have on the fibula, we have the lateral malleolus there and the lateral malleolus is always lateral. So there you are. There's the lower limbs